Good evening, everyone. Today is December 12th, and it's good to be with you again on our monthly virtual town hall about living with lupus and COVID-19 in our community. Thanks for joining us tonight. I'm happy to be here on behalf of our sponsors, including the Lupus Foundation of America Georgia chapter with Terry Iman and her amazing staff that do so much for all of us each and every day throughout the year, before, during, and after the pandemic. Also like to thank the Georgia Council for Lupus Education and Awareness with Representative Kim Schofield and our research group at Emory and Grady, the Georgians Organized Against Lupus cohort. Please take time to read our disclaimer when you get a chance. It's also on the web. So this is last month, a heat map of hotspots where a lot of the new cases are occurring. So this is last month. I want you to focus on where we are, and you can see that it's gotten a little bit darker, and we'll go over that in a minute. But going back to last month, you can see over here in Europe, just how it's kind of fairly active, especially in Eastern Europe, parts of Central Europe, and it's gotten a lot worse since then. And to the point where, if you've been reading the news, there have been lockdowns in several countries. Some countries have actually instituted a vaccine mandate for their entire citizenship, including Austria and some other countries. Things seem to be leveling off from what I understand, but we've lived through this before, and COVID does not know any boundaries. And as variants emerge, and we'll talk about that in a minute, these things will flare up again. And we're seeing that again in Europe, and we're starting to see that here in this country. So this is where we were a month ago. And this is where we are now. So a month ago, and now you can see a lot of the concentration, especially in the northern states and the Northeast, but you do see it's starting to spread down to the southern areas where it's traditionally warmer. But as we get into the winter and as people travel and cases occur here, people travel, and you can kind of see it sort of spreading throughout. And no area is really immune, as we're starting to see. And even though there are some places like New Hampshire that really stick out, all of the parts of the country are starting to go up in general. The Midwest continues to have a very high rate, and the Northeast is still climbing. And the West seems to be over there. But in the South, we've enjoyed relatively low rates, but we are starting to see it climb up. And so just remember the previous waves. We've all been there. We've either been one of the hotter areas or one of the cooler areas, but we're not immune to staying in any situation or static state as far as this pandemic continues. So this is throughout the country. You can see that new reported cases by day are starting to climb back up. The hospitalizations as a result are starting to go up. You can see testing, thankfully, is still in a relatively high number when we want it that way, so that we can try to catch cases and do surveillance. And the deaths are starting to catch up too. As we all remember, hospitalizations are first, and then the deaths happen afterwards, but they're starting to go up throughout the country. Now, where are we? In Georgia. Georgia, this is a month ago. And this is where we are now. So a month ago, we had relatively fewer darker areas, and we still have relatively fewer darker areas, but you can see it starting to coalesce and become more concentrated, and starting to come from the north down to the south, and it just sort of fits with the general national trend. And you're starting to see here in Georgia, this is the number of new cases per day, that we are starting to see that initial rise. And it's more than just kind of a little blip. There's just no way that Georgia's going to remain impervious to what's happening throughout the country. And so it's going to be a matter of time before this goes up even more. Testing is still relatively low. Hospitalizations are starting to plateau and kind of tick up, if you can kind of see that on your screens. The deaths are still going down, but that's because the hospitalization rates have not gone up long enough so that we see that. So you can see that down here. Also that the cases are relatively low still compared to where we were before and the rest of the country now, but it's relatively gone up a lot, a third, 33% increase over the past 14 days on a rolling average. And the hospitalizations are going up. The deaths remain low, but again, they're going to trail. Well, a lot of this has a lot to do with the unvaccinated population. Yes, there are some breakthroughs, and we'll talk about a little bit about that, but the Delta variant, and we'll talk about the Omicron variant, they prey predominantly on those that are unvaccinated. And when we see the general trend in Georgia starting to catch up with the rest of the country, our fear is that it's going to be even worse eventually because of the relatively few people compared to the rest of the country here in Georgia throughout. But this is a dashboard from Atlanta Strong that captures mostly numbers from the city, but you can see here the vaccination rates throughout the US are at 60%. We would love to be closer to 75, 85% as a country in order to kind of meet or get closer to that herd immunity level. But the rest of the country stands much better than we are in the state of Georgia at 52%, and Atlanta still reflects what's happening in the rest of the state and being around that number. Now, the vaccinations, it's hard to believe it's been about a year. It's been 1 year to the day of December 8th, I believe, when the first patient outside of clinical trial, or first person outside of a clinical trial, received a COVID vaccine in the UK. And here, that's her. And so it's been a year, and boy, time does fly in a way. It drags in other ways too. So what's been new since last month? Well, the Omicron variant is one of the biggest pieces of news in this area, obviously. It's a new variant that was first detected in Botswana and then just a few days later in South Africa. And the WHO labeled it a variant of concern on November 26th. And since then, we all know that it's been detected in multiple countries, including the US. And throughout the US, it's been in over 21 states detected, and I'm sure it's present in a lot larger number, including right here in Georgia. It sounds very ominous, right? The word Omicron, and people make fun of that, and it just sounds like a transformer and sounds very, dark and scary, and especially when you have the WHO, the World Health Organization, labeling it a variant of concern. But we have to put this into context. There's so much that we don't know. We're starting to get a sense of, but we don't have the final sense just yet. But the variant of concern and all these other labels is just that, we're being cautious. And there are reasons to be cautious. We don't know fully the picture yet, but here's what seems to be the general sense at this time, is that the Omicron variant seems to be more transmissible than even the Delta variant, which is highly transmissible. And that's because they're starting to see in areas of very low vaccination, like South Africa, where one of the earlier areas to identify this, that South Africa was at one point had extremely low numbers, and they were doing very, very well. But then if you look at the curves for Omicron, it just really went high very, very quickly, faster than the Delta variant did. And there's some other stories, like there was a Christmas party, and I think one of the Scandinavian countries, I think it was Norway, or don't quote me on that, but it was just one or two that eventually got tested positive, from a test right before the party, but then after the party, like 20 plus people became positive for the Omicron variant. And so, these stories and some other, pictures throughout the country and the world indicate that that there's a high likelihood that the transmissibility of this is extremely high, more or less the same, or if not greater than the Delta variant. So that's, obviously of concern, which is why the WHO labeled it as such, or part of it. But thankfully, there's no evidence that it causes more severe disease. In fact, there's a suggestion that it's associated with less severe disease. There's no rapid rise or significant rise at all in any of the areas that have an outbreak of Omicron with hospitalizations and death. So it's not something to completely be relaxed about yet, but that is very good news and something that we'll learn a lot more about in the next couple of weeks. But that's something that scared us a lot, obviously, and generally speaking, I think people are starting to be a bit more calm about that. The other area of concern is that it seems to be able to evade the immune system better than the Delta variant, in the sense that if you look at the mRNA vaccines, Pfizer and Moderna, that even after two of the shots, it's a two-step initial shot, that after the first series, the effectiveness seems to be much less, down to reported levels about 40% or so. But the good news is that the booster, which we all know, and it's a common phenomenon, it happens, and we are aware of that in previous vaccines, other vaccines, and the way the immune system works. The booster shots increase the antibodies to a much, much higher degree than the first two initial series of vaccines, including the COVID mRNA vaccine shots, so that the degree to which the increase in antibodies actually is able to bring up the effectiveness of these vaccines back to where it was, which is about 90% plus effectiveness against the Omicron variant after the booster shot. So, what really needs to be underscored is that, boosters are important for all variants, including the Delta variant, which is still by far the dominant strain. I didn't have time to find the graphic, but if you just look like a big pie chart or something as to what represents the Delta variant and what represents Omicron variant, it's still a very small slice of the pie. And so Delta continues to be very dominant. We'll have to watch Omicron, but both of these variants and future variants, it'll benefit those who have gotten the initial vaccine, and especially those who are immunosuppressed and taking immunosuppressive medications, like those who are living with lupus. It's extremely important to get that booster shot. And in fact, if you remember, it's people like those that have lupus that were the very first group to get the approval for the boosters, because we've had a lot of studies that in those individuals, the immunity wears down faster or wanes faster. So for the need for the booster occurs even sooner, and it's even more important. But the response seems to be very good still with the booster shot. So now that the FDA and the CDC approved the boosters for everyone 16 and older, it's important, I think, if you've gotten that, or someone who's gotten the initial round, that if it's more than 6 months afterwards, then they really should get boosted. We didn't have any questions this month, which is fine. So I thought there's a lot going on in terms of new medications and treatments in general for COVID. And I will it can be a little confusing as to what does what and when you should use what and what's available. And at some point in the next few months, I'll put together summary slides so that you can put it in your mind a little bit better. But it's a little too early to do that because there's so much changing. And what I thought I would do now is just to finish with a few slides on some of the recent action, if you will, that's occurred in the area of therapeutics for the treatment or the prevention of COVID. The first is this drug called Evusheld, and it's a combination of two antibody treatments that was issued in an emergency use authorization by the FDA. I just want to preface all of these, the next few slides, by underscoring the fact that vaccination is clearly the best method to reduce the chance of having a severe outcome due to COVID. But the great thing is that as science continues, we're starting to develop treatments or preventative measures that are ideally used in conjunction with vaccines in some way, but at least other options for people who either didn't get the vaccine or couldn't get the vaccine. So this combination of these two antibody or these two drugs here that are supposed to these monoclonal antibodies. I'm sorry, that's what I was trying to say. The combination of these two monoclonal antibodies are combined in this drug called Evusheld. It just got recently approved for an EUA, and it's for pre-exposure prevention of COVID-19. So exposure obviously is, you're exposed to COVID, but so this is for before you get exposed. So you don't have COVID, you're not suspecting that you have COVID, but you want to prevent getting COVID. And this was given the authorization for adults and children 12 years and older who weigh at least 88 pounds. So again, it's not currently infected individuals or those who are not recently exposed. And it's for specifically individuals who are moderately to severely immunocompromised due to a medical condition or due to taking immunosuppressive medicines or treatments. So obviously this is very relevant to us here in caring for those who are living with lupus. And so people who may not mount an adequate immune response to COVID-19 vaccination is where this drug would be ideal. It's also for those that have had a history of severe adverse reactions to a COVID vaccine or a component of those vaccines. And it's administered through two separate intramuscular injections. So it's just basically a shot into the muscle, one after the other, 2 times. And each one is these monoclonal antibodies that are injected. And they seem to be effective at prevention of COVID before you even get exposed to it for up to 6 months. Now, I have not had any time to look into this any further than much more than what you're reading. I do have a little insight into some of the studies up to this, but there's still a lot of questions in my mind as to how best to approach this in lupus and in rheumatology. I expect very soon that there will be some consensus statements out of organizations like the American College of Rheumatology, where a lot more experts in the field can get together and really sort of kind of give a broader set of recommendations that are more relevant to our community and people with lupus than what we have in this slide. But it's very encouraging that there are other options available for people at high risk that fit the category that many of us do in lupus, that may be able to help protect individuals for a long period of time, a relatively long period of time against COVID. The company is AstraZeneca, who makes it as well, and they're the ones that just came out with this new drug for lupus, Safnello. Also, kind of new since last month is an early, it's a drug, an antiviral drug that is designed early in a COVID infection that's symptomatic. So you want to prevent it from getting too severe, and you know that you're positive with COVID. The FDA panel narrowly approved this in favor of a drug called molnupiravir. It's not formally approved yet. The FDA panel narrowly approved it, and my understanding is that I think it should get reviewed soon by the CDC, or is it out there officially as emergency use authorization? I have to get that clear in my mind. But if it isn't available for emergency use authorization at this very minute, it will be very, very soon. And what this drug does, it's got this kind of abbreviation. It blocks an enzyme that the COVID virus uses to replicate. So it slows it down significantly. And this drug here that blocks the enzyme in COVID is mixed with another drug called ritonavir, which slows down our body's breaking down of this drug. So it allows it to stay in our body longer so that it can continue to work against COVID longer. So it's a combination of these two things, the PF07 blah, 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 with the ritonavir that makes this drug called molnupiravir and would be a good drug to take early on in COVID, and you're starting to have mild symptoms, you're a high-risk individual especially, and you want to make sure that you reduce the chance of this going to a more severe state. Please continue to come to us, share news in our community, look at trusted sources, the LFA Georgia site that Terry keeps up to date, as well as the LFA National site and other trusted sites that you're aware of. We need to fight against misinformation, and there's a lot going out. And this drug that I just talked about has been developed by Merck, and there's so much information that's out there in general, but it just seems like whenever something kind of good comes out, there's a lot of information that goes out against it. So there's misinformation about this new drug. It's saying that it's not as good as ivermectin, which has absolutely no proof at all, but it's still out there. I still hear stories about people getting that and preferring that. But I'm here to tell you that that's not true. And this is my last bit of news. There is a, actually, I think this is a repeat. Yeah, I think that this is a repeat of the previous drug. Yep. So it's not yet clinically available and will be evaluated by the FDA for consideration of EUA pretty soon. So, like I said, this is a good time. Anniversaries, change in the new year. It's always a good time to take stock in what's happened over the past year. And remember, I said that it's been a year since the vaccinations have started to roll out throughout the world. And we are in a much, much better place than we were a year ago. In terms of the pandemic, in so many ways, we have tools. Science has really brought amazing feats of accomplishment through vaccines, but also through understanding what the virus is, understanding how the vaccine works with the virus, what boosters can do to help. We have additional treatments now, both for those who have gotten COVID and are becoming symptomatic. And now we're starting to see treatments for those who may not be able to get the vaccine or are at high risk and have immune issues like those with lupus, even before they get exposed to COVID, and helping to prevent that from happening. We're learning so much more about this. And there's one projection about deaths and due to COVID, that the death rate has actually remained fairly stable throughout the world, even with some of these ups and downs of the variants, recently. And as we start to go into hopefully a time where we're able to prevent more and more of these infections with more uptake of vaccines and boosters, and we have more treatments available, and as the unvaccinated portion becomes smaller and smaller, and some of those will get infected and they'll have some natural immunity, that the models or the projections show that the death rates seem to be holding stable in the future and may be very, very low and stay low indefinitely. And that may be a time when we can sort of officially say that this pandemic becomes an endemic. COVID is not going anywhere. That's clear. And we've mentioned this possibility early on. And if there's been any dream of that in any of you, that's not the case, unfortunately. It's here to stay. It's going to be circling around the world. It's going to be part of our planet for the foreseeable future, but so is the cold and so is the flu. And we're dealing with that, and we're starting to see the early stages of that. Now, that doesn't mean that we're not in a cautious stage. The variants and their ability or potential ability to really bypass vaccines, there's always a possibility that the severity can go up several notches, and it can be very lethal or very severe for individuals with new variants to come. So the best way to protect ourselves is knowledge and support. And I hope many of you that are still on the fence continue to think and be encouraged more and more to consider the vaccine and the boosters. And together we'll get through this together, as we've been doing for the past year plus. So this is it. Thank you so much for spending time with me, and from hearing some of the updated news. I'll continue to work with you and work with Terry and the Georgia chapter to update each other. Please keep checking the website, keep sending your important questions and thoughts to us at the email address down here. We'll continue to meet regularly on the second Sundays, although I have a personal commitment next month, so I may not be able to join. So I would plan that we meet in February, but if anything changes, you'll be sure to know through the announcements that go out through Terry. So please have a safe and wonderful holiday. Remember that if you do get together, try to be around those that you know their infection status, they've been recently tested or not high risk or certainly been vaccinated. But if you are with a group of people that are safe in many of those regards, you should feel very comfortable, even having lupus, to celebrate with them. And what a wonderful gift that is in this time. And no matter what context, even if you're not able to do that, I do hope and pray that you will take stock in this past year. It's been very rough. But there are a lot of other things to be thankful for, and I am very thankful for you. You've given me so many stories of encouragement and reasons to keep moving forward and fighting. I've heard so many wonderful, amazing stories that I wish I could share in more detail, but I hope we'll be able to do that more in the future. So happy holidays, and I'll see you sometime soon.